Hey, Dr. Ray with Pro Holistic Care. Today I want to talk to you about some things you can do on your own at home to help with knee pain. So one of the most common conditions people call us about or schedule appointments for is knee pain. Knee pain can be coming from many different problems, from arthritis to injuries to inflammation in the joint. And when we're in the office, we can figure out exactly where that problem is coming from and what we need to do to help you. But we also want to make sure that you have some tips and some tricks and some things you can do at home on your own to help alleviate the pain when it's happening and to help stabilize that knee long term so that you start to build strength back up in the muscles and you can start to stabilize that joint and decrease pain for on long-term purposes. So today I want to focus on 5 exercises that can help you with joint pain and help to stabilize that knee. So the first one we're going to do is something called this Clam Shell. So I'm going to get down on the ground. Everyone wants to follow me. Now I recommend doing 3 sets of 10 on each side for all of these exercises, about 2 or 3 times a week. So the first one is a clam shell. So you just want to make sure that you have a pillow. Go ahead and lay on your side so you're nice and comfortable. And you're simply going to bring your knees to the front just a little bit, and you're going to slowly open and close the leg. That's going to start to strengthen some of the muscles of the hip, the leg, the knee, muscles around the knee, so that we start to stabilize that knee, but also improve mobility and decrease pain levels. The next one we're going to do is something called hip abduction. So we are going to straighten the legs. You can keep a little bit of bend in the bottom leg. You're going to straighten that top leg, and you're going to stabilize your hand in the front, and you're slowly going to bring the leg up as far as you can, and then bring it back down. Now, some people may be only able to get their leg up just a little bit, and that's okay. But you're going to go ahead and bring it up and down. Again, you're going to do 3 sets of 10, 2 to 3 times a week. That's going to help strengthen the glutes, the hips, the leg, everything. The next one we want to do is something called Glute Bridges. So for this one, you're going to get onto your back. Strengthening the glutes and the hips and the hamstrings is really important for knee stability. So we're going to bring the knees a little closer to our body, and we're going to simply lift up and come back down. Up and come back down. You just kind of want to get to neutral and then come back down. You don't have to push up really high. The next one we're going to do is something called straight leg raise. So you're going to stay in this position. You're going to keep one knee bent. So I'm going to keep this one bent. You're going to straighten the other leg. You're going to stabilize with both hands on the floor. And you're simply going to raise the leg up and bring it down. This is going to help strengthen the leg and actually stretch some of the posterior muscles as well. Again, 3 sets of 10 each side, 2 to 3 times a week. And then the last one is something called Hydrants. You're going to recognize this move. That's why it's called Hydrants. If you've ever seen a dog go to a fire hydrant, you'll know what we're talking about. But basically, it's going to be exercising the hip, the glutes, the outside of the leg. So you want to have your hands straight on the ground, and you just want to bring the leg up and down, up and down. So those are 5 great exercises that can really help you with pain in the knee, mobility issues in the knee, stabilize and strengthen those muscles around the knee. Dr. Ray, Pro Holistic Care.